So just in our experience as GPs, I think we're hearing a lot of messages out there that GPs are lazy, GPs aren't working hard enough, and that frustration that people are feeling that they're struggling to get access to the doctors. And from our side, working as a GP, we just want people to realise that we are working flat out, very, very long hours to try and get through what's an enormous workload. And the workload now is higher than it's ever been. We're working harder than we've ever done to try and get through all of the patient contact people. So many people are wanting to get their health problems sorted, and we are doing our best day in, day out to meet that need. We recognise that it's not enough, people are still really struggling. The waiting lists in hospital are so long, and often up to 2 years or even more to see a specialist. And that carries a huge frustration for people, and we recognise that, we know how difficult that is for people. But we can't control those waiting lists, and there's only so much that one person can fit in any one day. We are working much longer hours than I think most people realise. It's not unusual for me to work a 13-hour day and eventually have to switch my laptop off at home because I'm so tired I can't concentrate properly anymore. And knowing that there's still work out there, there's still people that need my help, and there's still stuff that I need to do, but I have to switch off because it's no longer safe to keep on working. I think that a lot of people are frustrated that they're still not being seen face to face. Certainly in our experience, anyone that requests a face-to-face appointment will get it. They may get a phone call first to confirm the details, how long the appointment needs to be, a brief summary of what we might need to arrange for them when they come in, but we will always do our best to accommodate that as much as possible. But the problem isn't actually really the number of face-to-face appointments. The problem is that we can't meet the demand of the patients because we just haven't got enough appointments. As a surgery, we're trying to recruit more doctors. We actually have the problem that we don't have enough space to put all of the doctors that we need, so we have space to expand within the surgery, but we're waiting for feedback that we're allowed to start building into that area to make more rooms, to allow more doctors and more appointments. Our gut feeling is that that's still not going to be enough. There's still not going to be enough appointments even with the extra doctors and the extra rooms because the demand for appointments is so high at the moment. And the services within the hospital are so stretched, and that's not a criticism of the doctors working in the hospitals, of secondary care as we would call it. We realise that they're all working flat out as well. The problem is in the NHS as a whole. And I think as doctors we generally feel quite strongly that we worry that this is the end of the NHS as we know it. Our concern is that the government is aiming towards privatisation of parts of the healthcare system, particularly general practice. And the big worry there is that it makes a much more difficult system for people to negotiate. Those with the money to pay for appointments will still get them, and those that don't will suffer even more, which are often the marginalised, the people that struggle already to get appointments. And private healthcare appointments wouldn't bring any more appointments. It would be the same doctors that would be working in that system to spread ourselves out. So it's not going to be a magic answer that perhaps it might be sold as. So all I would say to people really is the message is be kind. It's not fair to take your frustration out on the person in front of you. Our receptionists are dealing with a lot of angry and quite offensive language. And it's not okay, it's not acceptable, it's not fair on the team. The person in front of you, it's not their fault, the problem's in the system. They're doing their best to try and meet your needs as best as possible, just as we all are. So please be kind, understand that we're trying our best. Do contact us if you need us and tell us what you need, and we'll do everything we can to try and meet your need as an individual, but it will probably take a lot longer than you would like.